Hi, I'm Cynthia, and I'm a patient of Dr. Stallone's, and I've been asked to share a little bit about my story. I started with Dr. Stallone about 2 years ago for just general health things. I've always been into alternative health and taking care of myself, but a year ago I was diagnosed with breast cancer. I did have breast cancer previously, 11 years ago, and had a lumpectomy and took care of it that way. But in the years since, I had told myself that if I ever had cancer again, I would deal with it differently. And Dr. Stallone was a perfect person to be on that journey with me. He had a wonderful manner right away. There was no panic. I felt secure that I was in his hands. He knew what he was doing. He had a very successful cancer protocol that he's used with many people. I had a very unusual type of cancer for breast cancer. It was triple negative lobular. And so that changed some things. He was able to, as with everybody, cater to exactly what you need. So I started on the journey with him. I started doing a lot of immunotherapy, which I was doing 3 IVs a week, and doing high dose vitamin C with an ozone therapy that was also really good for me. Outside of the office, I was also doing other alternative therapies, and I let him know always what I was doing with that, kept him in the loop, and he was very supportive and worked with me and with the other practitioners and doctors that I saw, so that we could get, all on the same page and fight it. And I just, I'm past it now. I did end up having a surgery that was not expected, but I got to that point and did not want to do any kind of traditional chemotherapy. I had spent such a long time invested in the things that we were doing here with the IVs, and I also had gone on the metabolic diet that he recommended, a great book that was basically a keto diet with a few tweaks that took a lot of sugar and things out of my system, that was helping just make a healthier terrain. That he talks a lot about just your basic overall system and trying to be keeping your immune system as high as possible. And for me, I felt that chemotherapy might hurt my immune system more than build it up after I'd spent so much time doing that. But I was open to it, and he was open to it. We kind of went on the journey together, but we ended up with deciding, not he, but I decided I was going to have surgery, and he supported that. I have been here so many hours of so many days that you get very close to the staff, and they know all about my family. I know all about theirs. They remembered me on the day of the surgery. They remembered me on my birthday. I mean, things that you just don't, my family felt very, they let me know that they were really happy I was working with the people that I was, because they were like, what do you mean they did all this for you? I mean, they felt they couldn't be close to me, but they felt like I had people around me that were close to me, like a family, that were helping support me through the whole process. So I feel like I'm on the other side of it, but I'm still wanting to do some of the same things that I was doing all along with the diet and with keeping up with my IVs and trying to keep my immune system as strong as possible. And I felt like everybody here just was so great and so caring and very personal, and I just can't imagine having gone through this with anybody else.